Hey guys, I just wanted to give a big shout out to Anchor. Now that it's my second year of podcasting, I thought you all should know that I've only used Anchor to record all of my podcasts. And if you haven't heard about Anchor, it's simply the easiest way to make a podcast. Let me explain. It's free. There are so many creative creation tools that allow you to record and edit your podcast right from your own cell phone and your own computer. Anchor then does the hardest part for you. They go ahead and distribute your podcast so it can be heard on Spotify, Apple Podcasts, and so many other platforms. Now, I think it's everything you need to make your own podcast in one place. So what are you guys waiting for? Go ahead and download the free Anchor app today and head on over to anchor.fm to get started. Have fun. Hey everyone, welcome back to all my listeners. Now, I hope you're all having a great day so far. And if it's your first time finding me, thanks so much and welcome. Welcome to episode 11 of my 4th season. Today is Wednesday, November 10th, 2021. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, let me go ahead and start off with some happy, joy news. I can finally report that my backyard maple is lit up. At last, I've been waiting. It's just a glow in red, and it's such a simple pleasure that I look forward to year after year. And I wanted to let you all know that I enjoyed another incredible colloquium event this weekend from my good friend, Kimberly Jolivet Williams, down in the Dallas, Texas area. Now, remember, she was a special guest, a special Newsworthy guest that I brought on a few short weeks ago. Now, her weekend event was jam-packed with so many outstanding learning sessions with great speakers. Now, I wanted to let you all know that I do look forward to presenting for her colloquium when it ramps up again next year. Now, all right, guys, now I've got a lot to get into today, so I'm going to be diving into my compliance tip today and want to bring us back to basics with the elements of an effective compliance program. And hey, of course, my updates on the OIG Work Plan for the month of October are so very newsworthy. And I round out today's episode with the remarkable quote on illumination from Elisabeth Kübler-Ross. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I really love your support. Oh, and by the way, Cindy Weston was my latest 5-star reviewer, and she was so kind. She's the president of AMBA. That's our American Medical Billing Association. She is outstanding to have written such a glowing review. So thank you, Cindy, if you're listening today or if you're going to be binge listening anytime soon. I totally see you and I appreciate you. Thank you. Now, as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and recommendations based on my over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So, let's get into Newsworthy. Now, I wanted to go over the 6 new October 2021 updates made to the OIG Work Plan. Now, the first October 2021 update is titled Audit of IHS Telehealth Technologies Cybersecurity Controls. Now, this is an audit from the Office of Audit Services. Now, the COVID-19 pandemic response has included a significant increase in the use of telehealth technologies to provide access to healthcare. The dramatic growth in telehealth utilization has introduced new cybersecurity risks to medical facilities, including Indian Health Services, IHS facilities, that use these technologies. The OIG will perform an audit to determine whether IHS has implemented select cybersecurity controls to protect its telehealth technologies from these emerging cybersecurity risks. The final report is expected in fiscal year 2022. Now, the second OIG Work Plan update for October 2021 is titled Comparison of Average Sales Prices and Average Manufacturer Prices. Now, this is an audit from the Office of Evaluation and Inspections. When Congress established average sales price, that's our ASP, as the basis for Medicare Part B drug reimbursement, it also provided a mechanism for monitoring market prices and limiting potentially excessive Medicare payment amounts. The Social Security Act mandates that the OIG compare ASPs with average manufacturer prices, or AMPs. If the OIG finds that the ASP for a drug exceeds the AMP by 5% in the 2 previous quarters or 3 of the previous 4 quarters, the Secretary of HHS may substitute the reimbursement amount with the lower calculated rate. These quarterly memos summarize the results of OIG's comparison analysis based on ASP and AMP data. The memo specifically reports the number of drugs OIG identified that met the criteria for substitution of a lower reimbursement amount. The final report is expected in fiscal year 2022. Now, the third OIG Work Plan update for October 2021 is titled OIG Oversight of State Medicaid Fraud Control Units. This is an audit from the Office of Evaluation and Inspections. The 50 state Medicaid fraud control units, those are our MFUCUs, located in the 49 states and the District of Columbia, investigate and prosecute Medicaid provider fraud, as well as complaints of patient abuse or neglect in Medicaid-funded facilities and board and care facilities. The OIG provides oversight for the MFUCU and administers a federal grant award that provides 75% of each MFUCU's funding. As part of the OIG's oversight, the OIG provides guidance to the MFUCUs, assesses their adherence to federal regulations, policy, and performance standards, and collects and analyzes performance data. They also provide technical assistance and training and identify effective practices in MFUCU management and operations. The OIG will perform on-site reviews of a sample of MFUCUs. The final report is expected in fiscal year 2022. Now, the fourth OIG Work Plan update for October 2021 is titled Adverse Events: Disparities Among Hospitalized Medicare Patients. Now, this is an audit from the Office of Evaluation and Inspections. Disparities in the delivery of healthcare and patient outcomes are a significant U.S. public health concern, with communities of color and other disadvantaged groups experiencing poor health outcomes compared to the U.S. population as a whole. Now, research on disparities in patient safety and adverse events is limited, and this study intends to add to the body of information specific to health outcome disparities. The OIG will identify the extent to which disparities in adverse event rates exist and which patient and hospital characteristics are associated with higher adverse event rates. They will use the data collected for an ongoing OIG study of adverse events in a report, which includes detailed information about adverse events experienced by a random sample of 770 hospitalized Medicare patients. The OIG will also analyze these adverse events data in conjunction with demographic information available in the medical record, as well as other information contained in the CMS claims data or in publicly available data sets, such as the U.S. Census Bureau data. Now, an increased understanding of disparities in patient safety will help medical providers as well as researchers identify and address the underlying issues that contribute to the inequities in the delivery of healthcare. The final report is expected in fiscal year 2022. Now, the fifth OIG Work Plan update for October 2021 is titled Toolkit for Identifying Adverse Events through Medical Record Review. This is an audit from the Office of Evaluation and Inspections. The OIG has found that patient harm is common among Medicare beneficiaries in a range of inpatient healthcare settings. Federal regulations require that hospitals and other healthcare facilities identify harm, such as adverse events, and work to reduce these events. The OIG will use guidance materials and tools created for prior studies of adverse events to develop a web-based toolkit for identifying and measuring adverse events to help assist healthcare facilities, government agencies, and researchers in their efforts to improve care. They will share the resources that they developed and used in their adverse event studies to aid hospitals and other researchers in their own efforts to identify and monitor the incidence of adverse events. The toolkit will provide standard definitions for most event types, lists of triggers to flag patient harm, suggested guidance for reviewers, and considerations for clinical decision making. This final report is also expected in fiscal year 2022. Now, the sixth and final OIG Work Plan update for October 2021 is titled Nursing Home Reporting of COVID-19 Data to the National Healthcare Safety Network. This is an audit from the Office of Evaluation and Inspections. Since May 2020, nursing homes nationwide have been required to report COVID-19 data to the National Healthcare Safety Network, the NHSN, an infection surveillance system managed by the Centers for Disease Control and Prevention. Of course, that's our CDC. This requirement significantly increased nursing home enrollment and reporting, which was formerly voluntary, to the NHSN. This study will evaluate CDC processes for nursing home reporting of COVID-19 data to NHSN. The OIG will also assess CDC's oversight and support of nursing home reporting and identify challenges to reporting to NHSN that these nursing homes have faced. Now, the OIG work will inform the department's ongoing efforts to support infection surveillance, including the collection of routine infection data, as well as data related to the public health emergencies such as COVID-19. This final report is also expected in fiscal year 2022. So, now, I'm a big fan, right, of all of the new technologies and advancements and innovations that have been made during this pandemic when it comes to greater use of telecommunications for telehealth services. But unfortunately, as the first work plan item suggests, there will be vulnerabilities for cyber breaches occurring. So I'm glad that the OIG will be looking into what more needs to be done to protect the Indian Health Service hospitals and organizations. And I'm also happy to report that the OIG is developing a web-based toolkit for identifying and measuring adverse events patients endure while in hospital settings to basically help everyone from healthcare facilities, government agencies, and researchers in their efforts to improve care. So, I always have providers who need this critical information to review their coding and billing practices or their overarching compliance programs. I think these reports with findings are always most interesting and informative, and I always look forward to analyzing them in the years ahead. It's also important for my listeners to pay attention to these monthly OIG Work Plan updates to see how they may impact you, your provider, or your health system. Stay tuned for my monthly OIG Work Plan updates. They drop the second Wednesday of each month. And now it's time for my best practice tips in Trusty Tip. So, in today's new Back to Basics compliance tip, I wanted to focus on the 7 elements to an effective compliance program. Now, of course, there's so much that goes into the creation of each element, but I wanted to make sure that you know the fundamentals, the basics of these 7 elements. First, make certain you have policies, procedures, and standards of conduct. These should be written in such a way that anyone can understand them in order to maintain compliance. Use simple, clear, concise language that's relevant and current, specific to job functions, and reviewed on a regular basis, be it monthly or quarterly, and definitely annually. And make sure they're all readily available. Don't hide them or bury them in subfolder after subfolder. Keep them out, front, and center. Second, make sure you're designating a compliance officer and a compliance committee. These folks will, at minimum, prevent, detect, and correct noncompliance. They will support you and your unique practice and compliance program with sufficient resources. They will promote standards of conduct, and they will establish a clear means of communication for reporting noncompliance. Third, this one's probably most definitely my favorite. Have effective training and education for everyone. Don't exclude your people. This can be achieved by offering compliance training frequently, at a minimum, of course, annually. Make the training and education a part of their job requirement, and make sure that they're staying current on compliance issues and trends by attending conferences. Allow them to go. Make sure they're reading articles and publications and attend professional networking opportunities. Fourth, communication is fundamental. You should not allow your people to sweep things under the rug. Developing effective lines of communication is essential, and effective communication can be started with your visibility and your approachability. Keep your door open and keep your space safe by ensuring confidentiality, communicating the compliance message, and encouraging feedback. Provide methods for anonymous and good faith reporting. Fifth, do things in-house. This means conduct internal monitoring and internal auditing. Keep working for yourself year-round. Mitigate those areas of compliance risky business. It is this work that shows you are sustaining compliance program effectiveness. Go ahead and create that annual work plan. Determine any areas of risk. Proactively audit and review the compliance program. Sixth, you need to have well-published disciplinary guidelines. This ensures standards are followed continuously and consistently throughout your practice. Never assume the standards are being followed. It's scary, but you've got to look. Do not just bury your head in the sand. Check in with your people. Seventh, you need to spot the mistakes and correct them. Developing a method for tracking and responding to compliance issues, I always recommend dating when you discovered the offense. Mark that date. And then what you plan on doing about it. Record that as well. Thorough documentation and investigation are fundamental. Make those corrective action plans. Get an external team who may be better equipped to help you on this end. Have your personnel attend ongoing training after that corrective action plan, that CAP, is implemented. And document this ongoing training. All of this looks so very good to ensuring you actually do have an effective compliance program. Wow. So there's simply so much, right, that a compliance professional has to be cognizant of because there's an enormous regulatory and compliance burden placed on our physicians and hospitals and health systems at large. It's our job to help ensure these elements are properly created, disseminated, and adhered to ensure an effective compliance program is in place. I hope you find these back to basics helpful to decrease these volumes of fraud, waste, and abuse errors we've been seeing for years now. These back to basics will hopefully remind you that there's much more detailed information at our fingertips. We have to play by the rules, and the rule books are all out there for us to digest. So, a better, smarter approach is one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time so you and your entire team can perform compliantly. And finally, in this week's inspiring quote in Spark is from world-renowned psychiatrist and late author Elisabeth Kübler-Ross. People are like stained glass windows. They sparkle and shine when the sun is out, but when the darkness sets in, their true beauty is revealed only if there is light from within. Breathtaking, right? I think this is a perfect quote that reminds us, inspires us on the importance of illumination. Her deeper nuance here is rather profound. We are all deeply variegated, like stained glass windows. From the darkly welded edges of glass that hold each brightly colored piece in place, to the light that is needed to showcase their true beauty, both outside and inside. We can remember Ross's wise words when we need a moment to light that spark from within, again and again. I am happy Elisabeth Kübler-Ross's spark still burns brightly in all of us today. So, that wraps up today's episode. Please go out and make this a great day, an incredible week for yourselves. Aim a little higher, do a little more, and give back in any way you can in 2021. There's so much each one of us can do. And remember, this is the month of giving, so do your very best this holiday season to give wherever you can. As always, I appreciate you diving into today with me. And if you want more information from me, go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Please continue staying safe and healthy. Practice safety for one and all during our collective, seemingly never ever ending life and times of coronavirus. Thank you so much for listening on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.